Good evening, everyone. I'm Dr. Mariam Bashir. I'm an instructor at Institute of Public Health, College of Medicine and Health Sciences here at UAE University. So it's my great pleasure to welcome you all today to our webinar, our health promotion webinar on diabetes in the workplace, which is being organized by the Institute of Public Health here at UAE University, our Health Education Research Unit, the Medical Students Association, the Health Promotion Students Committee, in collaboration with SEHA. So our speaker for today is Ms. Souheila Hassan, who is a Senior Health Education Officer at SEHA. So before we start, just a few housekeeping notes. Sorry, I think it's stuck a little bit. Mr. Ismail, I think it's stuck. Can you help me with this? Okay, sorry about that. So just want to introduce first of all the webinar for you, and then we can go ahead and start the webinar. So this webinar is part of the IPH webinar series, which was launched in 2021, entitled My Health is My Decision, which aims to enhance public awareness on key health topics, to promote healthy lifestyle as well, and to encourage community engagement in different preventive health practices. So I will highlight the housekeeping notes here. If you have any questions during the course of the webinar, kindly click on the Q&A option at the middle bottom of your screen and write your questions there. We'll address them at the end of the webinar. Just to remind everyone that this webinar is being recorded, and you'll find the recordings at our YouTube channel, Institute of Public Health, CMHS, along with other past webinars. So I am pleased to inform everyone that this webinar has been accredited by the UAE University with 1 CME. And at the end of the webinar, we'll share a link that you will use for evaluating the webinar and fill in the form so that you can get your certificates at the end. So the World Diabetes Day this year is focused on diabetes in the workplace, with the slogan, "Know more and do more for diabetes at work." And our Institute of Public Health, in collaboration with CMHS students, have designed an initiative with different activities to mark this day in order to raise or increase awareness of diabetes within the community. So we've had several programs. We had the community outreach, and we're having the awareness campaign and diabetes screening in the main campus and here at CMHS. And for the webinar, our focus is diabetes in the workplace, and our speaker is going to tell us or discuss how to establish a diabetes-friendly workplace. So it is my utmost pleasure to introduce to you our speaker for today, Ms. Souheila Hassan, who is a Senior Health Officer, Education Officer at SEHA, and also the Chair of the SEHA Health Promotion and Education Council. She has over 25 years of experience in health education and promotion, and she has designed so many intervention programs in relation to health education and promotion. She has delivered several training modules and currently ensures compliance with patient and family education accreditation standards. So she is well known to actively advocate for public health and wellness across diverse population. Ms. Souheila is currently a PhD in public health candidate at Lancaster University. She had her MSc in healthcare management with honors. She is a master certified health education specialist. She is also a trained diabetes educator with the Imperial College London. She is currently an adjunct lecturer here at our college, CMHS, and she has had so many accomplishments over the she has had so many accomplishments over the course of her career, including establishing the first health education section at Tawam Hospital. And she is currently leading all health education and promotion services for SEHA facilities. So we are honored to have you here with us, Ms. Souheila, and the floor is yours. Thank you for coming.
Thank you. Salam alaikum. Good evening, everybody. I'm so happy to be here with you. I'm going to share my presentation, if you allow me, please.
Sure, you can share.
Okay. Can you see my presentation?
Not yet. I think it's still loading.
Now?
Yes, we can see your presentation now.
Okay, excellent. Establishing a diabetes-friendly workplace is the topic of the presentation. And today we're going to talk a little bit about diabetes prevalence. We're going to talk about diabetes needs of the persons with diabetes and what do they need exactly at the workplace. We're going to mention and a little bit tackle on the World Diabetes Day, and then we're going to talk about integrating diabetes in the workplace. As you know, like diabetes prevalence globally is increasing immensely, and it's becoming a public health pressing issue. And very important that we are now at alert that globally diabetes will be increasing by 2050 by 45%. And this is really calling everybody to work on preventing and promoting health according to diabetes. In MENA area by itself, there is a speculation that it is diabetes will be increasing by 92%, a number that we should really pay attention to, and we should really work on reducing it and putting some preventive measures regarding this topic. The diabetes, it's an estimated of 589 million individuals living with diabetes around the world, where 3 in 4 people are living in low and middle income countries, and 50% are not diagnosed or have diabetes, but they are not diagnosed. And the numbers are being alarming and are alarming. For the UAE, based on the International Diabetes Federation, diabetes has been thought to be like 20.7% prevalent in adults, which is also a number to pay attention to and to take care of. First, I want to start my presentation with the audience. I'm gonna call you to go to Menti. Sorry, there is an N missing. Go to menti.com, use the code or scan the code, and I want you to answer this question. Are you a working adult living with diabetes? So I'll give you 2 minutes to answer this question. Is it accessible? Can everybody do it? Dr. Mariam, can you do it?
Yes, it's accessible.
Yes, excellent. So we can see now on the screen the statistic coming up. So we have 5 people who have diabetes and 3 who doesn't. So I encourage the audience to answer this question. So from the majority of the answers, I can see that we have people living with diabetes, and we would love to know about your experience during the presentation time. Okay, so next we're gonna talk about is Living with diabetes, basic information that people with diabetes will know well, and people who are working in the health field are aware of it. As you know, diabetes is a long-term health condition where the body either does not produce enough insulin or cannot use insulin effectively. Diabetes is a serious condition that occurs when the pancreas is no longer able to make insulin or when the body cannot make good use of the insulin it produces. This affects how the body turns the food into energy, and in most cases, diabetes is a lifelong chronic disease condition. And this is mainly caused by insulin. Insulin is a hormone that controls the level of glucose, a form of sugar. And usually the insulin is like a key that opens the cell to allow the glucose to enter the cell. And glucose is the kind of sugar that goes into the cell. And usually it comes from carbohydrates. For more information, you can scan the code and get more information on insulin and how insulin works. There are three main types of diabetes. First type is type 1, which is not preventable. And usually this type of diabetes comes because some autoimmune condition attack the cells in the pancreas and it stops producing insulin. And that's why usually it comes and it doesn't have a treatment for now. It is commonly diagnosed in the childhood but can develop at any age. Most of the diabetes cases are type 2 diabetes, and they are usually when the pancreas stop producing or enough insulin, or the body cannot take the glucose into the body because the insulin does not work well. And this is usually diagnosed with adults and obese patients. Third type, well-known type, is the gestational diabetes, where the diabetes happens when it is detected when the woman is pregnant, and after that it goes after pregnancy, but it might develop later at the later stage. And usually the mother and the child are at risk of developing diabetes later on. Symptoms of diabetes, they are very straightforward, like excessive thirst or hunger. Usually the person is very thirsty, goes to the toilet frequently, has a blurred vision, feeling tired, and has a slow healing of wounds. Diabetes management differ by type. Like type 1, usually they are on insulin, either injections or pumps. Type 2 diabetes, they are first put on diet and exercise. If not, they start oral pills or sometimes, and they go for, at the end of later stage, on insulin. A way now of helping them to recover from obesity is the weight management injections, the GLP-1, where patients type 2 diabetes are taking these injections to reduce their weight and to recover a little bit from diabetes. Gestational diabetes, usually they are on diet or on insulin injection, depending on their case. Diabetes patients are always required to monitor their diabetes through glucometer or through continuous glucose monitoring by putting a device on their arm and checking and scanning it on regular basis to check their glucose level. Abnormal blood sugar levels, hypoglycemia. This is when the patient is having low sugar in his blood, and it happens maybe he took more than insulin than he's supposed to, or he did activity, and there are treatment like he needs to take either glucagon injection directly if it's a severe case, or take a fast-acting glucose, like taking a juice or honey, just for them to recover and monitor their glucose regularly. For more information, you can scan the code. Hyperglycemia is the same. This is the opposite when we have high glucose in the body, and usually there are symptoms that comes with it, and this is a very serious condition that require going to the hospital if it is very high, and usually patients are advised to take insulin or go to the hospitals if they're in serious, if they have having high symptoms. Diabetes complication on the long run, if the diabetes is not being taken care of very well, unfortunately, it affects the heart, it affects the eye, it affects the nerve, the oral, it affects the mouth and the kidneys. So we need to be very careful of when we get diabetes, that we are following the treatment regimen that we are provided and taking all the measures needed. To reduce complication and control diabetes, of course, lifestyle modification comes number one. Healthy eating. All diabetic patients are taught how to calculate the sugar and the glucose and the food calories. At the same time, they are advised to do physical activity, stress management, and of course, continuous glucose monitoring. Now we're going to start with our new question and asking our colleagues here who have diabetes or who are at work, what do you think are the challenges faced by people living with diabetes at work? What do you think they will have? So I'll give you a few minutes to answer this question. Paul, you can scan the code or go to menti.com and put the code and answer the question. Stigma and discrimination. Excellent. What else? No time to eat properly. Interesting. Hypoglycemia. Interesting. Fatigue and dizziness. Skip meal. So I wonder why we're skipping meal a lot. Maybe we don't have time. No understand the struggle. Okay, that's interesting. So as we see, there are so many different answers to this, which are around stigma, discrimination. Okay, thank you for answering these questions. No privacy for insulin injection. Okay, that's interesting. Okay, so the word diabetes day, how come it came on the workplace, diabetes workplace, diabetes in the workplace? So the IDF did a very interesting research. They have surveyed 1,400 adults in 7 countries. And as you see, the countries are listed in the slide. And they asked about how the diabetes patients or people with diabetes are dealing with diabetes at work. And the statistic came alarming. Like 46% of type 1 and 36% type 2 said that they have been negatively treated in the workplace. Also, there some people said about denied breaks, as you are saying in the Menti survey, and they missed career opportunity because they thought that diabetes will prevent them from going to applying for jobs. Another point is very important, that people were feeling uncomfortable when they need to inject themselves with insulin or checking blood glucose. They did not want to see the wary, starey eyes of their colleagues or their supervisor, and they were very hesitant to talk to their colleagues about it. And even they were very reluctant to talk to their supervisor about having this diabetes, so that it doesn't affect their job or doesn't affect their performance at work. So know more about diabetes. The 3 main points that came up after this survey is that diabetes, there are a lot of challenges for patients with diabetes at work. They are living in an unhealthy, prepared environment, and there are a lot of work that needs to be done for diabetes at work. And that's why I want to show you a small video that will talk about a lady who is a diabetes educator, and at the same time she's a diabetic patient, and what are the things that she's doing in a very low or middle income country. Let's see the video.
The voice is not on, I think. It's
Yes,
muted.
Dr. Souheila, it's not, the voice is not on.
Sorry?
The voice for the video is not on. So when you're
Okay.
about to share your screen, there will
Okay, so
be an option to share also the sound
the
on the
sound.
right.
Okay, sure. Okay, I'm gonna share it again. Sorry, I'm not able to share the sound. It seems that I cannot do it.
Okay, the video also is not showing now.
So when you click share in the button, there will be a screen that comes on. And then you can choose to, on the right side, there is share sound as well.
I'm not able to click it. Let's see again.
Yes, try
Yes.
again.
Can you hear it?
Yeah.
Living with diabetes made me more empathetic, resilient, and it helped
Can you hear it?
Yes, it was working. Yes.
Okay.
me understand how to juggle between my work life, my profession, and health. Hi, my name is Anna Manwar. I'm a diabetes advocate and diabetes educator. Currently, I'm based in Lahore, and I work for people with type 1 diabetes. Type 1 diabetes is a tricky condition. It comes with lots of financial burden as well. So we have identified that the underserved communities, it's very difficult for them, it's very challenging for them to manage everything on their own. Previously, when I was working in lab and when I was a research fellow, things were different. My colleagues were quite supportive, but the clock was ticking, and instead of looking at my glucose levels or injecting insulin or having my meals on time, I have to think about, if I have to run the experiment, when the machine is going to beep, when I have to change the culture, and see everything that is happening in the lab and seeing how my experiment is going. Even after being self-employed, when I have all the flexibility, there comes times when I have to travel, when I have to have meetings, and diabetes does not allow me to have that flexibility because it wants all my attention. Diabetes makes it tough to carry on the professional life. You always have to monitor yourself. You have to carry extra things with yourself, like insulin, glucometer, and other stuff to treat the hypos. So it is demanding and challenging. And professionally, till the time I wasn't using continuous glucose monitor, it was very haphazard. We need our times, short breaks. We have to follow the meal times, and it's not always doable. My workplace is very supportive because I'm self-employed. I can easily tell my boss that I'm not feeling well, and since she is living with the same condition, she can completely relate with it. I do feel that having continuous glucose monitoring should be a right for everyone living with type 1 diabetes because it does increase your work productivity. You do not have the hassle to rush to your bag and open the glucometer. At Indus Hospital, we have a project that empowers people by providing them diabetes education, and we provide diabetes education to people so that they can self-manage their condition. Sometimes we have peer support activities in the parks or indoor places where we have people of different age groups. So these activities and games really help them to meet each other, to share things with each other, which they can relate and learn from. And that gives them the concept that diabetes cannot stop you. Living with diabetes was a roller coaster journey for me. I really feel that we need to advocate even more so that everyone in this era could have access to insulin. I would like to give an advice to everyone who is living with diabetes that do share it with your colleagues, at least with one or two companions, because you never know when you are going in an emergency situation. I would urge all the employers around the world to do not judge people with type 1 diabetes or type 2 diabetes, because we are as capable as any other person. Sometimes just being supportive or a listening ear is more than enough for us.
So this was a very interesting video that I love to show, because it gives us the actual situation of what is happening and how the people with diabetes feel at work and what do they need. Like type 1 will need to take insulin during working hours. They need to monitor themselves. Type 2 may require oral injections of medicine or insulin. Gestational diabetes patients, they will need some oral medication. They need to check their blood glucose level. So all of these are like needs of patients that they will need during the work time. So how can we integrate now diabetes into workplace wellness? Like, is this something new? Is this something been done? It has been done, but not very well in our here in our area. But has been. I'm bringing with you for you experiences from US and from UK on some of the programs that been implemented. So CDC says if you implement a workplace wellness program that address diabetes, you are gonna reduce the healthcare cost by 25%. So from cost-wise, we're gonna be reducing the cost. So this is a positive point that we need that is related to implementing diabetes. But at the same time, there are so many reviews like umbrella review and systematic review to say that when you implement diabetes at the workplace, the patients will improve and also the business will improve. Like the patients, they will be able to control their diabetes. They're able to reduce their complication, improve their medication adherence, and enhance their wellness scores. Whereas for the business, you're gonna lower the cost of the insurance also, decrease absenteeism and presenteeism, high employee satisfaction, and improve workplace productivity and morale. So this is a positive thing and positive sign that echoes with the workplace wellness program. So workplace wellness program all around the world have proven to be very efficient. And to integrate diabetes into workplace wellness, I'm bringing for you this model from CDC, where you can integrate it by following the main 4 points, which is assessment, planning, and implementing, and then evaluating. You can assess, you can do a survey at your workplace, see how many people have diabetes, check what are the things that in your organization that are set for diabetes and what are the things that you need to improve. In the planning, you need to go and present it for your leaders, get their buy-in, put an improvement plan on how you can do it and what are the resources needed. Implementing it, putting a programs, initiatives, and benefits, and I'm going to tell you a little bit more about it, and then evaluate and check, link it to the KPIs, to the organization, and link it to the KPIs of the workplace wellness through different worker productivity, healthcare cost, improve health cost outcomes, and all of these related things. To implement a diabetes-friendly workplace, you need to take into consideration what are the inputs. You need a budget allocation. You need some money to start the project. You need to have expertise on board, like the video. There was a diabetes educator who was working on it. In addition to other specialized people like dietitian, you may need to have also physiotherapy to build in some exercise. So you need to think about it and what are the available resources in your area. Leadership support is very essential. You cannot move without it, because this will make your implementation much easier. And you can always partner with people from different scopes, so that you can bring, like, you can partner with facilities, you can partner with occupational health, you can partner even with finance and other providers. Educational materials to educate people about how to give support to persons with diabetes. For example, you need to have a manual for your supervisors, for managers, maybe some training. Maybe you need to have education material for the diabetes patients themselves and for their colleagues, and also technology infrastructure in case you will have a technology setting. Activities, you can do several activities at your workplace. Try to find out and teach people if they are pre-diabetic or diabetic and they don't know. Give some educational sessions, awareness activities, and of course you will need to develop some policies and some educational messages. You can do some pop-up messages just to remind people of the importance of managing diabetes and treating diabetes at the workplace. Output, of course, these are your KPIs, where you're gonna see how many people are screened, how many people you discovered have diabetes, participated in the education programs, how many people have participated in your awareness webinars, for example, what is their feedback, what is the evaluation, are they satisfied, do they need more? And then the improve health outcomes of the persons with diabetes, the rate of absenteeism and presenteeism, and enhance productivity. Reasonable adjustment in the workplace. There's always good to have a secure access for blood glucose checking equipment, medication, and insulin. If you have a small pharmacy in your workplace, that will be a good idea. Giving extra breaks. Sometimes the diabetes patients needs more time to check their glucose on regular time, and maybe sometimes they need to go to a place where they need to deal or treat their hypoglycemia episode. Private place for them to dispose the sharps, like to have a sharp container where they can dispose their needles. Sometimes the patients, if they are tired or sick, they need to have some rotating hours or work from home, or they come on a regular basis, depending. It is very essential not to discuss their case in front of people, or if you're accessing their medical history, not to share it with anybody. Flexibility for medical appointment. They might need to go for a medical appointment. And last but not least, in case of an emergency, like somebody who is trained or who can support them if they're having hypoglycemia or low blood sugar. In addition to that, it is good to frame the activities of the workplace wellness to take into consideration that they are diabetes-friendly initiatives. Like in workplace wellness programs, usually they tackle different dimensions. They tackle the physical activity, health eating at work, mental health, occupational health, and environmental. But how can these be implemented at work, taking into consideration diabetes patients? Like, we always encourage physical activity. We have gyms in our facilities, maybe. we have physical activity or some kind of walking, cycling inside the organization. These are the recommendations of physical activity, but very important when it comes to the safety of the diabetic patient. They need to check and be reminded to check their blood glucose before and after exercise, keep some fast-acting carbohydrate nearby for hypoglycemia. And there are so many activities that can be done. They don't need to go for exhaustive activities at workplace, but just in case they get hypo, we have to act directly and quickly for that. Healthy diet also is very important. We are promoting it at the workplace for our employees. Why not to promote it also for the diabetes, persons with diabetes? Like we need to help them to use some balanced meals, low glycemic choices. Why not to have in the cafeteria some choices of low carb? Why not to reinforce the healthy plate in our premises and help them to have a healthy snacking instead of having biscuits and having high carb food? Bring some low carb snacks like cucumber, like vegetables, like like something that they can nibble on, like nuts, for example. Hydration stands is very important to remind staff, not only persons with diabetes, but everybody, remind them to drink water as they walk a little bit. There are canteen menus, there are vending machines. We can always put some healthy options and support the health at our workplace. Mental health is very important. Now we see a lot of places, they are putting some relaxation classes in their facility to help employees relax and be stress-free. There are some very nice stress relaxing rooms that now set up in the workplace, and this is also can be used by the people with diabetes. It is always good to have some sessions with the psychiatrist or psychologist where employees can come and talk, be screened for depression, anxiety, and at the same time, they are encouraged to provide it with some skills and training on how to manage the stress. We had one of the very nice sessions in SEHA and we were surprised to see that really people were interested to attend these sessions, and where they learned about breathing techniques, learned about mindfulness, physical activity. For diabetes, for diabetes patients, it's good also to have this, to encourage non-stigmatizing culture. As you have seen in the video and as I have seen in your answers, still the persons with diabetes are afraid to disclose that they have diabetes. So a little bit of encouragement to show that we are all different, but we are all working together, and this is very important. Help them to disclose their disease and encourage peer support, maybe run or start a peer support group for employees that are having diabetes is a good idea. And of course, employee assistance program is essential. It comes with occupational support here, like provide them with trusted diabetes information, patient education, have some classes for them, like cooking classes or lunch and learn how to do like a good meal, or even teach them what to bring in their lunchbox when they come to work. Do some campaigns, especially like we're having now, as Dr. Mariam showed us, they're having so many different activities in the UAE University, to promote the knowledge about diabetes and how to treat it and how to manage it and how to screen it and how to prevent it is very important. Ongoing information, not just stick to one event, which is the Diabetes Day, also to send regular messages on diabetes prevention. This can be through different media at work, emails, newsletters, even pop-up messages, just to remind the employees about this important topic. A very important topic also is the emergency preparedness. There was some discussion worldwide to include a diabetes prevention kit or management kit with the emergency and first aid. There are pros and cons to it, but it will be good to have some glucagon emergency kit and blood glucose monitor with the emergency supplies in case it's needed urgently at work, and also to know who to call when there is an emergency. Of course, I'm talking about the hypoglycemia and when people start losing consciousness or they are having severe signs. Environment support is very important to make the people at ease having diabetes, like provide a private room for glucose check, keep some spaces, keep it clean, give them some containers to put their injections, and ensure confidentiality and not people just coming curiously to know what's happening. Inform staff about the available facilities so that they can use it, and train supervisors and managers. Last but not least, I would just end my presentation with a reminder for people just to know that we do have pre-diabetes, and it is 50% not diagnosed. A lot of people are living around us and they have pre-diabetes. It's very important to know that people will not are living with this condition for more than 10 years and it's not detected. But detection is very essential to deal with it and try to minimize the signs and try to minimize the complication as much as we can. And sometimes if we tackle it from the beginning, we might not develop diabetes. We might develop it at the end, but it is very minimal for long years. And this is what we encourage. Risk factors of prediabetes, people sometimes that have family history, they are not eating healthy food, they are not active, overweight. These are signs for you to watch out in case you want to help a friend, a family member, or somebody to go and do a blood test, a simple blood test that will help them to know if they are at risk of having diabetes. So let's all stop diabetes together and work on it so that hopefully the prevalence that I showed you at the beginning start decreasing rather than increasing all around the world. Thank you very much. And of course, preventing of diabetes, how can we prevent it? Let us try to work on our lifestyle modification, stop smoking, trying to eat healthy food as much as we can, move as much as we can, and make it a point. If I'm sitting behind the desk for 8 hours, try to go and walk around the office. Try to go park your car a little bit far from the office and walk, monitor your weight, and be healthy as much as you can. These are my references, and thank you for listening.
Thank you very much, Ms. Souheila, for this really outstanding presentation. And thank you for drawing our attention to the challenges, various challenges that is being faced by so many people living with diabetes at the workplace, and for highlighting important and practical recommendations and solutions. So to our audiences, please, if you have any questions, kindly post them at the in the Q&A box before they share the questions. I have a few questions for you, Ms. Souheila. So my first question is with regards to the role of colleagues or co-workers. You know, so what would be your recommendations for co-workers if they have a colleague that has to support a colleague who has diabetes?
You know, Dr. Mariam, this is a very essential point that you're tackling, and it seems like around the world, persons with diabetes are still hesitant to confide and tell that they have this condition. Actually, we encourage these people to talk to a trusted colleague, because sometimes they need the support, sometimes they need the help, that they are not feeling well or they are feeling weird and they want somebody to support them. And peers and colleagues at this time, at least they can call for help. If they cannot help directly, they can call for help because they know that this person has a certain condition. So peers are very essential and supportive in this case.
Okay. Thank you so much. And another question is regarding those who have pre-diabetes, you know, and or let's say in a workplace that they don't have anybody with diabetes, but they have like workers with pre-diabetes or other risk factors. So what will be your recommendation to the employers in this case on how to prevent diabetes? Because like you said, this is not like a one-day thing or a one-time thing. We need to have like a sustainable approach or system. So what would be your recommendations to the employers to prevent diabetes?
Recommendation is to have regular screenings and encourage screening at the workplace, like having, when we're doing a campaign, it's good to do, or if we are not able to have screening at the workplace, just to invite the employees to go on a screening and find out if they are at risk or no. When you are pre-diabetes, you have the chance to reverse it and not to become a person with diabetes or having the disease and the condition. So it's better to attend it early and maybe have a presentation, just a small presentation to highlight it on a webinar or in a meeting, if I can say that. Just one moment for your health, like we have it in SEHA in different angles. For example, we do have a broadcasting channel that broadcasts some healthy topics for our employees. Sometimes we have a pop-up message: have you checked your have you done your regular screening? These are the tests that you can do. There are a lot of things that can be done from leadership perspective and even from the workplace wellness perspective. But the most important thing that we do it, and we do it on a regular basis, so that we keep reminding people that this is an important topic that needs to be tackled on.
Thank you very much, Ms. Souheila. So in the Q&A box, I can see Dr. Mansour is asking whether he can speak. So Dr. Mansour, if you can hear me, please you can unmute and ask your question. Can you raise your hand, please, so that we can unmute you?
Yes, hello.
Yes, please.
Salam
Go ahead.
Alaikum salam.
Thank you so much, Dr. Souheila. Amazing presentation and such an important topic. Just to give you an insight, I'm a consultant family medicine and occupational health and in charge of the clinic in the Do Telecom company. And alhamdulillah, we have an in-house clinic, and we've seen the results that you have mentioned when we took care of our chronic patients, including the diabetics, for example, in premium cost saving or engagement of the employee. My question to you, is there a plan to deliver these kind of awareness sessions to HR professionals? Today, one of the challenges that I see in many companies, which obviously they might not have a clinic or an in-house health expert, The sick leave, sick certificates goes to the HR team. And usually those are the team which might be aware about some people who are suffering from some illnesses. And they might be in a situation where they can train managers or sit with line managers to accommodate special cases, special situations, and at the same time keeping the confidentiality, because there is a very fine-tuned balance between the confidentiality that the patient wants and the support he is expecting by not disclosing everything. And at the same time, they don't want to feel discriminated. So my first question, is there a plan to spread this awareness to HR professionals? And number two, if there is a company who has HR, who has a management or a manager who cannot understand that different diabetics have different requirements, what would be your approach to such a challenge?
Okay. For the first question, like HR play an important role. I'm gonna tell you about our experience in other programs. We haven't implemented diabetes education, but HR sits with us in the workplace wellness committee, and we have them on board and we involve them in our activity. Diabetes has to be taken on several levels. It needs to be taken on the strategic level, it needs to be taken on the operational level, and it needs to be taken also at the individual level. It cannot be done on one stage only. And to be honest, there are priorities at the healthcare organization, and sometimes we need not just education, we need enforcement, and we need the environment. We need sometimes the local authorities like Abu Dhabi Public Health Center, like DOH, setting some guidelines and setting some regulation on that. And I think this is how we can move. We can move with HR, but at the same time, we need to have the whole country talking about diabetes prevention and promotion. And we need everybody to work together so that we can implement it and flag it as a very essential point to be tackled in our workplace. The second question, I haven't understood it.
The second question about a manager. If you have a manager who cannot appreciate that a diabetic has a different need, because they will say, I have so many other diabetics and they are doing the job. Why are you specifically asking me for less working hour? Because they think diabetes affect everybody the same.
Actually, it's very interesting, Dr. Mansouri, what you're saying. When I was reading and working on this presentation, diabetes was included in the Disability Act in several countries and was identified as one of the disabilities. And that's one thing that maybe we need to work on in our country, to include it as one of the conditions that need to be taken care and taken into consideration. In the UK, in the US, they take it as a special condition, and they put some regulations on how to treat it and not to discriminate it, actually. And at the same time, to support the condition as if I can say, like, because the person with diabetes, they have varying needs. Some of them, they can do the work very easily and simply, and others, they need some, maybe change their work or work on a very relaxed work environment, if I can say that. So this is something that we need to work on from the governance side. And put this maybe diabetes and train the managers how to deal with this kind of condition. And hopefully we get there, especially with the alarming prevalence that we're having all around the world.
Thank you so much. Really appreciate it.
Thank you.
Thank you, Dr. Mansour, and thank you, Ms. Souheila. I think because of time, we are going to stop here, but I have one question here. Someone is asking what to do when they have the risk factors for diabetes, whether they should take metformin tablet or better to do physical activity and diet. So I think for this one, kindly reach out to your healthcare providers, please. to
Yes,
get
do
screened.
not take medication without going to the healthcare
Exactly.
providers, please. Especially metformin or glucophage, people are taking it as if it's something curable. Not everybody can take it. Please contact your healthcare provider, please.
Okay, so at this juncture, I would like to thank Ms. Souheila Al Hassan for accepting our invitation and coming to our webinar today. And you gave us a very enlightening presentation on diabetes in the workplace. Thank you so much for coming, and I hope you'll join our future activities. And yeah, so this is our link or QR code for the webinar evaluation. Kindly scan it so that you can get your CME certificates, inshallah. So I would like to thank everyone involved in making this webinar possible. I would like to thank the management of our department, our college, our university. Special thanks to Prof. Fatma Al-Maskari, Professor Michael Grivna, Dr. Azhar, Mr. Al-Sajir, and thank you very much, Mr. Ismail, for helping us with the technical difficulties. And I would like to thank Dr. Ifat El-Barazi also, who is the head of our Health Education Research Unit. And finally, I would like to thank our audience for your active participation and support, and I hope you will join us in future webinars. So I would like to invite you to please join us in a future webinar, which is titled SEHA by our Department of Health. So it will be on the 10th of December, inshallah. So please join us, and I hope we'll see you. So thank you so much, everyone. Take care and goodbye. Thank you.